I think everyone has a little bit of rosacea.
Oh, you do?
That's my Roman Empire.
Okay.
I think everyone has a little bit of rosacea. Just because you can't like see it because maybe your skin type doesn't show it so well, doesn't mean that that's not playing a role there.
Yeah. I'm Susan Yara, and welcome to My Life Online. We're going to have a lot of fun and learn a lot together. We tend to have a lot of dermatologists on the show, but usually we focus in on one specific issue. For today's episode, we brought in Dr. Julie De La Cruz. She's a board-certified dermatologist at Miami Dermatology and Laser Institute in South Miami, and she's instead answering all of your questions. We put this prompt out there on Instagram and on YouTube, and there were some really good questions, including questions about hair, so she's answering all of it today. All right, this is a fun topic because there are several of them. We just decided to ask my followers on Instagram to send in all their questions for you. And I think that they've really sent in some great questions. Are you ready?
I'm ready. Let's do it.
Okay, wait, before we get into it though, will you give a little bit of a background on your career and what you do, what you specialize in as a dermatologist?
Sure. So I'm a dermatologist here in Miami, and my specialty is in cosmetic dermatology, medical dermatology, and hair restoration, non-surgical and surgical treatment options. It's an absolutely incredible job that I have here, and I'm able to take care of patients from all age groups. One thing that I absolutely love to do is laser treatments and combining them in different ways to make my patients just look as good as they feel.
Yeah, I love that. I have one personal question because it's just interesting to me. Since you specialize in hair, have you seen like a rise in the brow transplants?
Yeah.
You have?
Yeah, I think it's more like awareness that it's an option.
Yeah.
And so then therefore the demand increases.
Yeah. Especially because like my generation is very like, we were the over tweezers of the brows. So
yeah, exactly.
To know that we can get those brows back.
No, exactly. You can just take them from the back of the scalp and put them back into the front.
So it's a myth that it comes from.
Oh, you can actually transplant them from anywhere, technically, but the most common place is going to be from the back of the scalp.
Okay.
Yeah.
Where did we hear this? Wait, Anna, we had heard that it comes from the pubes, right? And we were like, absolutely not.
Actually, like some people are transplanting the pubic hair into different other places.
Interesting. Mm-hmm. What would be the benefit of that? Because it's different hair. That hair is way different.
It is different. Yeah. I mean, in general, that hair is coarse. And so you could do like an eyelash transplant with that.
Amazing.
Yeah, be careful where you go for that kind of thing. But yeah, it's possible.
Noted. Eyelash transplants with the pubes. All right. I'm going to get to the viewer questions. All right. The first one is, what are the best skincare habits and gadgets for well aging without surgery? I'm sure you get a lot of people who are like, I don't want to do plastic surgery. I don't want a facelift. I don't want a brow lift, whatever.
In general, the best skincare habits, and you probably heard this from every single dermatologist, is 1, to make sure that you have a solid routine.
Yeah.
And 2, to make sure that routine includes sunscreen in the morning.
Mm-hmm.
That's probably the best habit to have. And then once you've got that down, you can start adding in other parts of your routine, whether that's a retinoid at night or a vitamin C in the morning or a moisturizer. But as long as your sunscreen is on every day, it's the cheapest way to look good longer. And then as far as gadgets, I don't know if they're referring to like at-home devices.
Yeah, probably.
So I think that the LED world has kind of blown up.
The masks.
Yeah, the masks for the face, the neck, and the hair.
Okay.
So there actually is some data behind it. I actually do recommend it for my patients for hair.
What do you think about microcurrent devices?
In general, I'm not using them and I'm not recommending them, but
why?
Maybe it's because I'm a laser specialist and I've just seen bigger bang for your buck when it comes to like in-office procedures. I just haven't been convinced yet.
That microcurrent is the way to go.
Yeah.
What about in-office treatments that are not surgery?
Almost all the treatments that we do in the office are not surgery.
Mm-hmm.
So it's going to be your lasers, your energy-based devices, microcoring. I'm not sure if you heard that.
Microcoring?
Microcoring is super cool. It's probably one of the newest things in dermatology right now. And so if you know microneedling, you know it's where you're taking needles and you're puncturing the skin in order to stimulate collagen. Microcoring is you're taking coring needles to puncture the skin.
How big are these needles?
400 microns, 420 microns, super small.
Small, but bigger than a microneedling
Absolutely.
device. Okay.
Yeah. And it's sub the threshold for creating a scar.
Okay. So before you get a scar?
Yeah.
Okay.
So you don't get a visible sign of a scar.
Okay.
And so you remove those little microcores. And what it does is your skin kind of heals like bottom up. And so you don't have open skin after. They almost immediately close up after the procedure. And then we did a study that actually looked at the genes before the treatment or at the time of treatment, and then a month after and like 3 months after, and show that it really upregulated all of the genes that like collagen and elastin, all these really good skin genes by a ton.
Okay, so who would be the ideal candidate for that?
Anyone who has like some moderate laxity to their skin. If you're somebody who has their partner or friend stand behind you in a picture and like hold your neck back, probably need like a neck lift.
Yeah.
But if you just have some excess skin or you want to work on your jowls, then this is
That's
a
what
nice
you should be
treatment
doing.
option.
Does it hurt?
We numb you.
Okay.
Yeah. It doesn't hurt really after.
Okay.
And you're numb during it. So
okay. Interesting. So somebody who has, how about like smile lines? That's probably one of the big things that I hear.
that's,
people-
yeah.
Mm-hmm. How about crow's feet?
We're not there yet.
It's too intense for crow's feet area.
I think so.
Okay.
You'll see.
Noted.
New studies are going to be coming out.
Okay. Interesting. So it's that new.
I mean, it's been around for a few years now, but like more and more studies keep coming out for new indications, like indicated for lower face, moderate laxity.
What other reasons would people want to come in for a laser treatment?
Okay. So I kind of have this box system.
Okay.
Like box one, let's say you're someone who wants low downtime and you want to just like polish the skin, clean up the skin. You're my box one person.
Okay.
Right. So we're doing a combination of lasers to kind of clean the canvas. You've got brown spots, you've got red spots, you've got maybe some fine texture, some fine lines. That's going to be nice for you.
Okay.
Box two, you want to work on laxity. You have crow's feet. You've got these deeper lines around the mouth. You have excess skin on the cheeks or on the necks. That's box two, but that's more downtime. That's like your CO2s and your erbiums, like more downtime lasers.
Are those kinds of lasers okay for all skin types, skin tones?
No, not for all skin tones.
Okay.
I think that probably in general, the erbium is safer for the darker skin tones. It really depends. So every single person is different in terms of their skin type, but also their ethnicities. Like what their ethnicity is also plays a big role.
I mean, I've experienced that where I've gone to even a dermatologist, and because I have fair skin, they assume I can do more, like anything like heated and stuff. But then it turns out my melasma flares. Like it goes crazy. So I now only see derms for laser treatments if they understand my skin tone.
I think that's super important.
Yeah.
And I think something that people need to discuss more is that lasers there's heat coming through.
Mm-hmm.
It's like a true tool. And so you got to be really careful of who's holding that.
Yeah.
One thing wrong and someone could be blinded, like God forbid. You know?
Yeah, I know.
Someone could be burned. You don't want that. So
no, that makes
take
sense.
a lot of care to make sure that the patient is going to do well, so they're a good candidate for it.
That makes sense. Okay, and then is there a box 3?
So box 3 is like miscellaneous. Are you trying to get your tattoos removed, hair removal, scar treatments, burn treatments, birthmarks, whether like vascular malformations, port wine stains? That's box 3. Okay. There's also this like 1.5 situation where you're getting like a light resurfacing.
Okay, this next viewer says, I just turned 40. What are the best well-aging treatments? I guess more for like preservation and upkeep.
Lifestyle habits is number 1. Are you smoking?
Yep.
Stop. Are you drinking a lot? Try to cut back. Are you getting a good night's sleep? Are you hydrating? Are you eating well? I think those are really like underrated things that influence how you age. And then how your sun protection is. And then what you're doing to like take it to the next level.
Okay.
Are you doing injectables, lasers? Is your skincare routine the best it could be?
I mean, I guess for each person, it's going to be different. And so they need to come in and do a consultation, right?
That's the thing. It's like every single person is different. And my recommendations change per person.
Yeah.
Like even skin routine changes.
Yeah.
What's your skin type? What are your other conditions? Are you going to flare your melasma if we do something?
Right. My personal opinion is the best in-office cosmetic treatment you can get done for people who are like, I haven't done anything. And they're like starting to age a little bit. I'm like, neurotoxins are my absolute favorite.
Yeah.
Like I think people see the biggest difference with that. What's your thought?
I think neurotoxins are awesome.
Yeah.
I really do. In the right person again. So like it really depends. Like, people who should not get neurotoxin are those who have like Bell's palsy, neuromuscular disorders.
Right.
Like be really careful. But they do make a big difference. And I think that just by relaxing your muscles, you can just really see a difference.
Yeah.
Especially here in the glabella.
Absolutely.
Like right in the center.
Yeah.
You just like look more peaceful.
Am I mad? You'll never know. Ooh, okay. What's your take on retinoid use? Is it better to do like a low percentage, like less, like lower strength retinol and do it every night, or like amp it up to high prescription strength and do it just as many times as you can I guess days a week?
I feel like you know my answer. It's going to be, it depends on the person.
Yeah.
And it depends on their skin type and like what they're willing to do.
Right.
Because some people will remember to do their routine if it's an everyday thing.
Right.
And then never remember if it's a 3 times a week thing, because it's easier to do your daily routine than a 3 times a week routine. But I have to say, when I get my patients started on prescription retinoids, I do start them at 3 times a week.
Okay.
And then I amp it up to every other night and then every night. I try to get them to the every night of whatever it is that they can tolerate.
Your next question. How about for somebody who has like really thin under eye area? They're starting to see a lot of crepiness. They're starting to see crow's feet. What are you recommending for these people? Skincare and treatment.
It depends on the skin type, and it depends why they have that crepiness under their eye.
Okay.
Because some people have this volume loss, which is why you're seeing the crepiness under their eyes. Other people actually have like untreated medical conditions like eczema around their eyes, and it's just like inflamed, which is why you're getting the crepiness.
Right.
So you got to like just treat whatever the cause is.
Okay.
Now, let's say that it's laxity, which might be what you're referring to here. Then my favorite would be doing like resurfacing lasers with laser-assisted drug delivery, with like PLA on top to help stimulate your own collagen to make it look smoother.
Okay, I have a personal question because it's under eye. So neurotoxins essentially at this point don't do anything for my crow's feet. Like I still, they're never going to be as smooth as they used to be with neurotoxins. So is it resurfacing that area, you think?
That's my favorite thing to do, yeah.
But I might be going in to resurface my under eye area.
Yeah, come on in.
Sounds good. How long does PRF stay under the eyes? Like how long is the effect, I guess, is what this person's asking.
It depends on the person. Usually it's around I'm sorry for always saying that, but it's true. It really does. But people, it's on average, it's like 6 months.
Okay. Actually, 6 months is good.
6 months is pretty good. Yeah.
Okay.
And the idea is collagen stimulation. So really what you're hoping is for improvement that's building on itself over time.
Well, actually, for people that don't know what PRF is, let's actually talk about what it is.
Sure. So PRF is platelet-rich fibrin. And so, we've gone over PRP a lot of times. And so PRP is when we take your blood, spin it down, and re-inject it into the scalp or into the face for a rejuvenating effect. Then enters PRF, where you're actually trying to create a clot with that spin down blood. And you're taking that fibrin clot and then re-injecting it. And so we kind of nickname it as like a natural filler, like it's you to you. So that's the nice thing about it. You just got to make sure you're going to somewhere where it's going to stay really clean. Because you can imagine if you're working with blood products, you want to keep it as clean as possible.
Oh, right.
But the nice thing is, you're getting this soft tissue augmentation effect with your own blood.
So does it, like filler, do you see like an effect immediately?
Yeah.
You do? Because I feel like PRP, you have to wait a little while, or like even lately I've got in for platelet-derived growth factors. And I feel like you see a little bit of a difference, but it still takes a little while to truly see a difference.
Yeah, there's different things that are taking effect. So like there's the physical volume that you're putting in. So you're going to see an effect from that. But the collagen stimulation part, like you're looking at a lag of like 6 weeks.
Okay.
It's like a lag time for that to happen.
Right.
But you asked if it was similar to filler.
Yeah.
There's different types of filler.
Okay, that's true.
There's so many different kinds. Hyaluronic acid base, there's calcium hydroxyapatite. And then within each type of filler, there's many others. But within like hyaluronic acid, for example, there's different G primes. There's different like strengths of the filler and elasticity. But the thing with platelet-rich fibrin, it's just one density.
Okay.
So to speak.
What do you think about all the trends in biostimulators and biorejuvenating, I guess injectables like Sculptra?
I love it.
Renuva, you're into it?
I love it. Yeah, absolutely. I love biostimulants.
Why?
Because you're stimulating your collagen, your elastin, and then our new studies show that you also can stimulate fat and even bone. Yeah. Why not?
Yeah.
And I also love to use it with my lasers, like on top. So I'll create these little microchannels with the laser and then do laser-assisted drug delivery with this biostimulant on top.
Wait, I just heard this last night. Somebody told me about like how she gets microneedling and then they do Sculptra on top. Do you think that would be beneficial?
So that's actually a really good point because there was a study that was just done. I was at the American Society for Laser Medicine this past weekend in Orlando. And we like put all of our studies out there. Everyone's sharing their research. And there was a study that was just done. I think it was at Harvard. I'm not sure. They looked at how Sculptra, how it can get to the bottom of different channels that are created. And they showed that they didn't really get to the bottom of the channels of the microneedling. They kind of stayed right on the surface. And I think it's because the channel's too thin. And also the way that like the pressure between the top and the bottom, the pressure difference doesn't really allow those bigger sculpture particles to get down. But with the lasers, the resurfacing lasers, they work.
Interesting. Mm-hmm. So what would be your favorite biostimulator to use with lasers?
Sculpture. PLA, yeah.
Okay.
Yeah, I really like it.
Interesting. Okay, wait. This might be something that
I'm open
like,
to.
Hello, what's up, Dr. De La Cruz? I'm here.
But I'm open to the new ones that are coming out too. But just PLA has been around for so long and does so well with my patients that it's hard to replace it right now.
I see. Okay.
And it's kind of in its own category right now.
Yeah.
Like you can do so much with it. You can inject it and you can do it topically.
Yeah.
When you make those microchannels.
I had no idea you could do it topically. So this is like exciting and new to me.
I mean, you're not putting it on like your plain face, but
yeah. I mean, with the microchannels, what would that do for you? I guess if you're not injecting it and you're doing with the lasers.
Again, it's stimulating your elastin. So like, and collagen. So like you said, you have these crow's feet that are not loving Botox. So whatever neuromodulator.
Not reacting anymore. Yeah.
Yeah. So you make those microchannels, put the biostimulant on top, and then you stimulate the smoothness in the skin.
I'm there. I'm making appointments right now. Okay. Melasma comes up a lot with my viewers because it's something I've had to deal with since pregnancy, which has been years now. So this viewer is asking, what is your favorite treatment for melasma?
There's many subtypes of melasma. And I think it's important to recognize it. It's not one size fits all. There's epidermal melasma, which is really superficial. There's dermal, which is deeper. And then there's a mixed component, which is right in the middle. Mm-hmm. It involves both layers. Knowing that determines whether we're going to do a topical only regimen or we're adding in lasers or are we going to orals, like oral tranexamic acid, for instance.
I did oral tranexamic acid for a little while because of a derm. And I actually did see a difference. I think for me, what was the biggest difference was when we started to realize there was a vascular component. There were two things that really worked for me. Actually, three things. Cosmetic was like the best thing that ever worked for me. Brutal. That whole month sucked. Yeah. Looking like an Oompa Loompa. A peely Oompa Loompa. But it worked really well for the topical. The other two things, the PDGF, when it got injected, we did it kind of in my under eye area. But I had this added effect where suddenly my melasma started being better.
Wow.
Which was not something that they told me. It's that I noticed it.
Wow.
I started being like, wait a second. And then the third thing that got added into my routine that helped me a lot, and I just stopped taking it. So I'm curious if it's going to start coming back. And that was low dose doxycycline. And that was because I had perioral dermatitis. And that just was so stubborn, wouldn't go away after using tretinoin for a little while. And I had it for like 2 years straight that it just like kept coming back. So a derm put me on the doxycycline. And one of the added effects was I started to notice that my melasma wasn't going crazy.
Maybe we should write a case report on you because that's super interesting.
Yeah.
Doxy technically makes you more sun sensitive.
Right.
And then being more sun sensitive should flare your melasma.
Yeah.
But we do Doxy in patients with like rosacea all the time in perioral derm.
Yeah. Because
it helps with the like inflammation component, which then drives melasma. So I think it's quite interesting.
Yeah, for sure. For sure. Well, okay. So my viewers will know this. I am convinced I'm like a self-diagnosed rosacea patient. Like I'm convinced I have rosacea. Like I said, my melasma got better. My redness in my cheeks got better while I started taking the Doxy. And of course, my perioral dermatitis got better. So I just stopped taking it like a week ago.
Your Doxy?
Yeah. So I'm curious to see. I was on it for 2 months.
I think everyone has a little bit of rosacea.
Oh, you do?
That's my Roman Empire.
Okay.
I think everyone has a little bit of rosacea. Just because you can't like see it because maybe your skin type doesn't show it so well. Doesn't mean that that's not playing a role there.
Yeah.
And so I actually agree with you there.
Yeah.
So I think that specifically a lot of melasma people have it.
Yeah, because it makes sense because we would treat, I have done everything. I'm like besties with a bunch of derms, right? Like, so of course I've tried everything. They all have like, they're like, okay, we're going to get to the bottom of this, right? Like every friend of mine. And so we go in, we do these treatments and stuff, and some work, some don't. And I think what we start to realize, or what I've started to realize is the different components of it, right? The vascular component was the one that we were not handling at all.
Yeah.
Like
that's why I do it for everyone. I handled the vascular component for everyone.
When you said that, I was like,
yeah,
interesting. Since you're an expert in hair treatment, let's talk about that because I'm finding this is a bigger and bigger topic is treatments for hair loss lately, especially in women, which I associated when I was younger with men, right? Going bald, like the extreme of it. But then now I guess like after pregnancy, I've experienced hair loss and regrowth and the constant cycle. I told you because of my thyroid, it's like never ending I'm always like, I always have little babies all the time.
Me too.
And stuff.
Yeah. I have these little babies
It's like
after my baby.
Yeah, it's crazy. And then I find that like a lot of friends now, as we're in our 40s, they're all like, I'm getting thinner hair. So what would be, I know everyone's like minoxidil is like step one.
Mm-hmm.
What would you say?
Well, I think the step one is actually finding out why you're having hair loss.
Okay. I knew you were gonna say
Yeah.
that. Okay.
Because there's like tons of reasons for it, of possible reasons for it. Interestingly, I find that most of my patients have a combination of reasons for it. So with almost everyone that comes in first, I do a scalp exam with my dermatoscope. Like I'm looking at your hair. I'm looking at the follicle. Is there scale around it? Is it inflamed? Is there scar? Is there no scar? Like there's so many different components of the hair itself that you may not recognize as someone who's just seeing hair is falling.
Right.
How many hairs are falling? When did it happen? Were there big stressors 3 months ago? Those are all, first of all, taken into consideration. Then I do a lab work for everyone. I check their thyroid.
Okay.
I check their iron levels. I check their vitamin D. And I check their like underlying hormone levels, like their DHEAS.
Oh, interesting.
Because I want to know why they're having the hair loss.
Wait, so vitamin D and iron play a factor into it also?
Mhm.
And of course, those are the two things that I'm like the lowest in.
Yeah. I mean, you got to set yourself up for success.
Yeah.
So if like the inside of you is not balanced, then the outside of you is not balanced. That's why the skin and the hair tells the truth of something that's going on deeper a lot of times.
Right. That makes sense.
Okay, let's say that it's bread and butter androgenetic alopecia, which is your hormonally, genetically associated hair loss, which is the most common form.
Okay. For men and women?
Yeah.
Okay.
So let's say it's that. Then typically, and I've done my lab workup and your labs are perfect. So then I like to start with either red light therapy at home, if someone can commit to like a 6 minutes a day kind of thing.
Yeah.
PRP injections. Actually, there's a new laser coming out that actually has come out that has been shown to increase hair growth.
Okay.
Super cool.
What's it called?
It's called the Folix laser, actually.
Do you have it?
I want to have it. So
Okay.
it's brand new.
It's brand new.
Mhm.
Okay. Exciting.
Yeah. And it's just a 30-minute treatment, and it increases. It's shown based on the studies that have been published so far to increase the hair growth.
Does it seem like it has downtime?
No.
Ooh.
No, I think it's honestly going to be such a big game changer. That's like my base.
First round.
Right?
Okay.
I like to then incorporate minoxidil, finasteride, and or spironolactone, depending on the person.
Okay.
So if you are a childbearing woman, these are not options for you right now because it's not safe for you. In the right person, it's a topical minoxidil or finasteride or an oral version of those medications.
Okay.
And then is like restoration surgery.
Okay.
Which I think is kind of underrated.
Like, is that hair transplant?
Yeah.
Okay.
Because you can even do something like change your hairline.
And actually, like now I'm at the age where I like guys I know are starting to get hair transplants. So I'm seeing how it goes. It seemed really easy, actually. Like easy process considering like, you know, like plastic surgery. Like if you think about like a nose job that people are just like quick to do, right?
Yeah.
I see these guys get their hair transplants and I feel like they're in the office. I feel like it's a long process depending on how much they're transplanting. Right. But then the healing process compared to like the nose job, like they throw on a hat and they're good to go.
Exactly.
Yeah.
It's not that bad.
No. And then they're like, they've got like little follicles for a while and then it like kind of falls out and then they've got hair.
And their life has changed. Because I think that a lot of and this is actually a reason I got into hair. I think a lot of your emotions are connected to your hair. I think we hold a lot of our emotions in our hair.
It's true.
And so, yeah, I like that. But something that's super important to tell people who are getting those hair restoration surgeries is that you should be doing medical management too, because you don't want to, waste your investment that you just did.
And when you say medical management, you mean taking
the rest of those things that I was talking
Okay.
about on that ladder. Like, are you doing your Rogaine? Are you doing your finasteride if that's the right person?
Yeah.
Are you keeping it up with your PRP injections?
Yeah. All right. This is a question that somebody asked. Are there any home remedies for removing warts that you'd recommend?
I actually do think that the salicylic acid and duct tape is pretty good.
Really?
Mhm.
Just throw a little, like what percentage of SA?
Usually it's like the 20 or 40% that
So
you can
high
find.
percentage.
Yeah,
Okay.
yeah. You're trying to kill that. You're trying to kill those skin cells that are on the top. When you come into the office, one of the most common things that we do is we freeze it with liquid nitrogen.
Yeah.
Trying to do the same thing, trying to kill those like little wart infested cells at the top. Try to get to the base of where those HPV, group of cells are growing and to kill those.
Yeah.
But doing things at home is only going to help it.
I guess that makes sense. Okay. Noted. It's just a lot of skin cells.
I mean, it's a virus that's causing overgrowth of these skin cells.
Like it's a little more complicated than that.
But yeah, that's why they're like thicker areas of skin too.
I see. Okay. Good to know. Ever since I talked about having perioral dermatitis, then I start finding out like everybody seems to have perioral dermatitis lately. And one person actually told me that her derm said after COVID, like after COVID was a thing, after the pandemic, they saw this like rise in perioral dermatitis. And now all of us that are dealing with it, we're kind of like, will it just always come back? Like, are we always going to deal with it now that we've had it?
I think there's like, you're definitely going to have like flares if you haven't been able to control the trigger of what it is. And I think the trigger changes on the person. So is the trigger a fluorinated toothpaste? Or is it having too much makeup, like too much product on? Or is it over exfoliating? What's your trigger? And that trigger changes on each person. And I think it is like chronic, it ebbs and flows. So you just got to be more mindful.
Okay. So to kind of like finish things off, do you feel like there are big trends that you're starting to see in cosmetic procedures or that people are starting to come in and request more?
Yeah. Okay. Well, trends that I'm seeing overall is that more people care about their skin in general.
Yeah.
Like now versus 10 years ago, it's incredible.
Right.
So that's a good trend. There's been some weird trends that I've heard about.
Okay.
Like, I'm not sure if you've heard of like I don't know if you want to say it.
Yeah, say it.
Like the period blood trends.
Weird, right?
Weird.
Like why?
It's so weird.
You
like,
know,
even if it isn't, even if it's beneficial to your skin, that's one of the things that I would kind of draw the line on just for hygiene's sake.
You know what I tell people as a person with a skincare brand, what we do every single day is we try to think of ways that these ingredients can actually penetrate that top layer of your skin just so you see the true benefits that we're claiming it's going to give you. So the fact that you think you can put anything, avocado on your skin, period blood on your skin, and you think it's going to be that beneficial, you have to have figured out a way to get it to penetrate your skin to be beneficial, unless it's just topically soothing it. That is like the one thing that you know, like an at-home product can for sure do is like be topical soothing. But if you have not figured out a way to get it to actually absorb into your skin, and when I say absorb, because people get all freaked out about how things absorb, like it's really very minimal what it's going to do for your skin. So putting blood on your face just seems like the stupidest thing. And it's not even just blood, it's period. So, ew.
Yep. The snail mucin was a big trend.
Yeah.
Which I think is nice. It's like natural hyaluronic acid. Some people don't like the feeling of it. Some people love the feeling of it. So that's kind of hit or miss. Interestingly, I think face masks have gone up and down in how trendy they've become. How about you? What trends do you see?
The biostimulators for sure.
Yeah.
The salmon sperm for sure. I feel like everyone's trying to do just like small, like everyone's like making everything seem like micro. You know what I mean? Like micro everything. They like micro it, even if it's really just like the treatment, like micro Botox.
Yep.
Micro, you know, whatever. It's like micro dosing everything. I feel like I hear micro all the time now. And I'm like, I just kind of roll my eyes now because I'm like, what's the micro about it? Like, just get the treatment done. You know?
Just a little bit. Just a little bit.
They're like, just a little bit. Tiptoeing into it. It's like, why? Just get it done.
I think one of the nice actual trends right now is I think we've gone away from the trend of overfilling.
That's true.
And we're going back to this like natural, I think everything goes up and down. Like eyebrows, for instance, you were talking about over plucking and then it was like super thick eyebrows were in and now it's like somewhere in the middle.
For sure. Yeah. And I definitely the dissolving of HA fillers. I went through it myself. I did it like 4 times, like trying to like get my face back to more of like a normal place, which then I hated the 4th time. I was like, fill my face back. Bring it back.
There's so many though. There's so many HA fillers. I think that they've like gotten a really bad rap.
Yeah.
Like you can find the right product that's super soft and subtle.
I agree. And listen, I'm not anti-HA fillers at all. Truly what like I try to tell people is that I dissolved it because back when I started getting it, the technique was different.
Yeah.
Right? So like there's different techniques now. People know how to use it a little bit better. I don't know. It's just one of those things where it's not that I'm anti, it's just get it done well.
No, I hear you. Amen to that.
Yeah. Well, thank you so much for this and for answering all of these questions because I know we hit you with a lot of them. And I know a lot of it was, it depends.
I know.
But that's okay. It's okay because I think a lot of us understand that it's all personal when it comes to our treatments.
Totally. Everyone's different. But thanks so much for having me. I had a great time.
Thank you. Thanks for joining us on this episode of My Life Online. If you enjoyed this podcast, make sure to follow, rate, and review, and also share it with a friend so we can continue making great episodes for you. You can also find me on social media. I'm at Susan Yara. And if you enjoy beauty, especially skincare, make sure to check out my YouTube channel, Mixed Makeup. I'll talk to you soon.